cancer journey, it's a very devastating for the patients, and they need all the support that they can get.
I get to be part of patients throughout all of their journey of their care.
I think we do play a very important role.
No 2 days are the same. I really like that. So it's very varied and really enjoyable.
You can make it what you want. To become a cancer CNS, you need to have an interest in cancer. And I think it's about learning to become an expert in that field and being able to support patients throughout their journey.
A lot of the CNS job is advice, and patients take your word for it, so you really need to know what you're talking about.
Training is very important, and there is training that is required. Not all of it is easy, but then again it's up to individual to decide.
If you think you want to become a CNS, think about shadowing other CNSs, but also education. Having a course in cancer management is really useful. Having further education at a degree level or a master's level is really important, but having that enthusiasm and wanting to learn.
The basic chemotherapy, radiotherapy, surgical side of it, a good history and physical assessment also helps.
It's been an absolutely wonderful journey. Yeah, you have to learn a lot. You have to, have difficult conversations with patients. Overall, it's probably the best job that I ever had. And it's probably, if I was to start all over again, I would say I would take the same one.
So I think patients really enjoy having someone who understands what's happening with them, who is there throughout their journey, who they can call if they've got a question.
For patients, it is easier for them to talk to nurses. It's somewhat time pressured to talk to the consultant, so we all have to adjust sometimes.
Yeah, I mean you're supporting them and their families through a very, very difficult period of their lives. The work is full on, definitely, but it's about managing your time, and that's one of the skills.
Some people in my team work a 4-day week, so they work condensed hours over 4 days. I work a 5-day week, but I work 9 to 5, which works very well around my family.
The team around me support me very well. I'm very proud of them. My manager supports me. The surgeons are very supportive as well.
We have team meetings as a group. We also have hospital-wide meetings to discuss developments going on. So if something's happening in the breast team, they can share that with us and we can take that learning along. I feel very supported in my role.
So by being a specialist nurse and practitioner, I do bring a lot of experience and knowledge to the team, and for that I'm respected by my colleagues consultants.
So career development, some posts they start as a band 5 or starting as a band 6 onto a 7, and then you can go on to being an 8A up to a nurse consultant. I would say to an aspiring CNS that I would encourage them into the role.
I just say if you want to really make a difference for the patients, you should go down the route of being a CNS.
There's so much opportunity, there's so much for you to learn. Get some exposure, get some experience, go for it.